What if your health journey went beyond the typical prescription written on a prescription pad? Today, Manitoba health professionals are taking a fresh approach to your well being. They're using social prescribing to help people connect with community. Growing older brings many transitions. Older adults may face feelings of loneliness or social isolation that can have an impact on their mental and/or physical health. However, these are not inevitable parts of aging. Increasingly, staying connected is seen as vital for maintaining mental and physical health as we age. Research shows 20% of Manitobans aged 65 years or older are socially isolated. 1 in 4 older Manitobans are lonely, and 1 in 3 would like to participate in more social activities. It's normal to not interact with people at times or feel lonely occasionally. However, long-term social isolation or loneliness impacts quality of life and can have negative health effects. In fact, the increased risk of death of social isolation or loneliness is similar to smoking 15 cigarettes a day. There is also an increased risk of diseases such as stroke and heart disease, as well as an increased risk for anxiety, depression, and dementia. Loneliness and isolation are avoidable. Research shows that for each additional social activity an older adult participates in, there is a corresponding 43% decrease in the likelihood of that person developing a disability. Social prescribing is a non-medical healthcare approach that connects people with community programs and social activities. It's like a prescription for social interaction. Everyone has different interests, so social prescribing is usually tailored to a person's unique likes and dislikes. Activities might include yoga or walking, painting or gardening, cooking or having a meal together, volunteering at a local animal shelter, or taking a pottery class. In Manitoba, a social prescription is sent from the health professional to the Senior Resource Coordinator. The Senior Resource Coordinator then works to help guide people to the right community programs. Whether it's exercise programs, classes, nature events, group activities, or volunteering, the goal is to help patients thrive beyond the clinic. People who've benefited from social prescribing have seen improvements in their mental and physical health.
I didn't know where to turn, but the support I found through social connection was just what I needed.
Raymond felt lonely and without purpose and didn't know where to turn. But with the support he found through social connection, he plays cards at the rec center a few times a week and has adopted a kitten. He feels like he has a new lease on life with purpose and happiness.
Joining the community walking group helped me feel connected again. It changed my life.
Sophie felt secluded in her small apartment, but after getting a social prescription, she connected with a mall walking group, and now 3 times a week she meets with them for an hour walk and coffee afterwards. She's more active and happier as a result. Social prescribing has gained momentum in Manitoba, and there is fact-based evidence that shows connection with community is good for a person's overall well-being. To learn more, talk to your healthcare provider or visit www.manitobaseniorcommunities.ca for more information.